father was diagnosed with cancer about 7 months ago. He's had surgery and radiation treatment, and she's worried about his cancer coming back. She's also worried about her own risk of cancer. She remembers hearing ads on the TV talking about ways that Albertans can reduce their risk. She's not sure she even believes that, and she's not really sure what that would even look like. She gets to the website, and she sees that there's 8 ways to reduce her risk. As she's digging down each of those risk factors, she's finding all kinds of information and even some pretty neat tools, but none of them link together. They're not synergistic. They don't connect in any way to the tool she's already using, like MyFitnessPal, and she's wondering why she's having to guess on some of the information that perhaps somebody else already really knows, like her screening history or her vaccination status. What Sarah needs is a one-stop shop with tools and information and support to manage her own risk and create an action plan to help reduce her risk. Let us show you how that could work. We've developed a tool that begins with a risk assessment that asks evidence-informed questions, some of which she would input herself and some of which she would draw from the social networking sites that she's already a part of, like Facebook and Fitbit. She gets her information into here, and then it generates for her an evidence-informed summary of where her best opportunities are for reducing her risk. So the bars that are showing up in red are showing her action areas where she really can start taking better control. So for instance, vaccine is shown up for her as an area of red. She could click on that and immediately be taken to an Alberta Health Services decision tool for determining whether she wants to and is eligible for the vaccine, and then connecting her to those services that she can use to get it very quickly and rapidly. Ultimately, we'll generate for her an overall score that will show her where she is overall in her cancer prevention journey, and be able to modify that and update that with information as she takes the actions that are recommended. That could automatically be updated as well through her fitness apps or her other diet apps as she goes along. Benefits of this: even if 1% of cancer cases were prevented in Alberta right now, this would translate into about a $6.4 million savings for Alberta Health Services every year for treatment costs alone. This tool itself would also be very useful for primary care providers and others who are interested in helping patients manage their risks, so that they could guide their patients to this tool and be supported along their care pathway. The things that we have going for us on this: Alberta Health Services is a trusted source of information, and we have funding to develop this. We have a plan that's been supported by the Deputy Minister and a lot of community partners, but what we really need is support from our internal partners to make this a priority. Let's help Sarah and all of us reduce our risk.
Currently similar types of things out there?
There currently isn't. Actually, Jessica, our research associate, spent about 6 months trying to find a tool like this anywhere else that could do this. The American Heart Association has the closest thing. It deals, of course, with heart risk factors, but it does a good job of the assessment, but it doesn't do any of the connecting sort of work that we're talking about here.
Any other judge questions?